Is your bladder bossing you around at 2 a.m.? Hello, my friend. Let me guess, you're up at night again, not for a midnight snack, not to check the thermostat, but to pee. And it's not just once, is it? Maybe 2, 3 times? Maybe you've started noticing your stream isn't what it used to be. Slow, hesitant, sometimes feeling like it never quite finishes. Now I want you to hear this loud and clear. You're not alone. And more importantly, this is not just aging. It's a signal your body's trying to send you. I'm Dr. Jonathan Prescott, a physician who's walked this road with countless men over the years. And today, we're talking about a condition that affects millions, but doesn't get talked about enough. Benign prostatic hyperplasia, or BPH. In plain English, it's when your prostate starts growing, not in a dangerous way like cancer, but in an annoying way that messes with your sleep, your bladder, and your quality of life. In this episode, we're going to unpack what BPH really is without the medical mumbo-jumbo, why it happens, and no, it's not your fault, what you can do right now to slow it down, and the truth about those supplements and treatments you keep seeing ads for. If you're tired of sprinting to the bathroom or feeling like your bladder's got a mind of its own, take a deep breath. This conversation could be the beginning of real relief. Let's dive in together. What is BPH and why should you care? Let's break this down like I would if you were sitting in my office, sipping a cup of tea and asking, Doc, what exactly is BPH and do I have it? BPH stands for Benign Prostatic Hyperplasia, which is just a fancy way of saying your prostate gland is getting larger. It's benign, meaning it's not cancerous. But don't let that word fool you. It can still cause some serious disruption in your life. The prostate, if you're not too familiar, is this little walnut-sized gland that sits right under your bladder. It wraps around the urethra, which is your urine exit tube. Now imagine that gland swelling up like a balloon and squeezing that tube. Yep, that's why you're having trouble urinating. Here's the kicker. By age 60, 7 out of 10 men have BPH. By 80, it jumps to 8 out of 10. That means if you're watching this and you're over 60, chances are you're either dealing with it or you're about to. Now you might be thinking, well, Doc, I've been told my prostate's enlarged, but I don't feel too bad. And that's fair. Not every guy with BPH has symptoms, but size doesn't always equal suffering. Some men with small prostates have horrible symptoms, and others with large prostates feel fine. It's not just about how big it gets. It's about where and how it's pressing on the urethra. So what does this look like in real life? You might notice frequent urination, especially more than 8 times a day. Urgency, that sudden I gotta go right now feeling. Nocturia, waking up more than once at night to pee. Yes, more than once is not normal. Weak stream, like you're watering the lawn with a leaky hose. Hesitancy, where you stand there waiting and waiting to start. Start and stop flow, like someone's messing with your faucet. And the classic, feeling like you didn't empty all the way, only to get a dribble later. Yep, the surprise leak. In more severe cases, your bladder can get so full it overflows. That's called overflow incontinence. And it's like your body saying, I warned you, now I'm handling it myself. And here's where I get serious for a moment. When older adults wake up multiple times at night to urinate, it's not just annoying, it can be dangerous. Every trip to the bathroom in the dark is a chance to trip and fall. And once an older person falls and ends up in the hospital, the risks skyrocket. One statistic shows that after a fall-related hospitalization, the 1-year mortality rate can climb to up to 20%. That's not a typo. That's why I don't shrug off these symptoms. I treat them with the respect they deserve. Oh, and let's clear this up now. BPH is not prostate cancer. It doesn't turn into cancer, and it doesn't mean you're more likely to get it. But because both conditions affect the same organ, it's important we monitor your PSA levels and do proper screenings. So if your bladder's calling the shots these days, it might be time we take the mic back.
Why does BPH happen? It's not just about aging. So now that we know what BPH is, the next natural question is, why is this happening to me? And let me say right up front, it's not because you did something wrong. You didn't sit on a cold bench, you didn't drink too much water, and no, it's not your punishment for that chili you had in '92. BPH is a complex, slow-moving process, and it mostly comes down to three things: hormones, inflammation, and your genes. Thanks, Dad. Let's start with the hormones. The prostate is a hormonally sensitive gland, kind of like your body's barometer for testosterone and its byproducts. One of the key players here is something called DHT, dihydrotestosterone. Think of DHT like testosterone's cousin with a bad attitude. It's powerful, and it stimulates prostate growth. Now, as you age, your overall testosterone drops, but oddly, DHT can stay active in the prostate. So even though you feel less energetic or strong, your prostate's over here saying, let's get swole. That's where some of this overgrowth comes from. But hormones aren't the whole story. The next piece of the puzzle is inflammation, a low-grade, chronic kind that simmers under the radar. This can come from past infections, even ones you didn't know about. Changes in the microbiome of your prostate? Yes, your prostate has a microbiome too. Science is wild. Hormonal imbalances, or even autoimmune changes. Inflammation sets off a cascade of chemical signals like epidermal growth factor, insulin-like growth factor, and TGF-beta. No need to memorize those. These signals tell prostate cells to multiply. More cells equals a bigger prostate. Worse yet, this cycle creates low oxygen zones. We call it hypoxia, which actually fuel more inflammation and more growth. It's like the prostate gets stuck in this loop: grow, inflame, repeat. Now let's talk genetics. If your father or brother had BPH, especially if they had it before age 60, you're more likely to deal with it too. Some men start showing symptoms in their 40s because of their genetic blueprint. But wait, there's more. There's this thing called metabolic syndrome, that cluster of issues like diabetes, high blood pressure, obesity, and high cholesterol. All of these jack up your risk for BPH. For example, men with diabetes have twice the risk of developing it. Why? Because these conditions also create, you guessed it, inflammation. And don't forget about the sympathetic nervous system, that fight or flight part of your body. When it's overactive, then chronic stress. It causes the smooth muscles in your prostate to stay tight. That can exacerbate your symptoms, even if your prostate isn't that large. It's like your plumbing is being squeezed from the inside out. So to summarize, you've got hormones poking the bear, inflammation fanning the flames, and genetics opening the front door. No wonder the prostate gets a little out of control. But here's the silver lining, my friend. Some of these factors can be managed, and that's where the next part of our conversation heads: prevention and lifestyle changes that really work. Shall we keep going?
How to reduce your risk of BPH. Taking the wheel back. Now here's some good news, and I love delivering good news. You can actually do something about BPH. No, we can't turn back time yet, and we can't change our parents' DNA, though I sometimes wish I could ask my dad a few questions. But what we can do is make small, meaningful choices that slow prostate growth and ease symptoms,
without rushing to medication or surgery right away. Let's break this down into real, doable steps. 1. Keep a healthy weight. I know, every doctor says that, but here's why I really mean it in this case. Studies show that men with a BMI over 35 have more than double the risk of developing BPH compared to those with a BMI under 25. Double! And your waistline matters too. If your waist is over 40 inches, your risk jumps another 50%. Why? Because excess fat, especially around the belly, is like a factory for inflammatory chemicals. And remember, inflammation is fuel for prostate growth. So even losing just 8 to 10% of your body weight can significantly reduce symptoms. 2. Move your body. Just a bit. Here's some incredibly hopeful news. You don't have to run marathons or hit the gym like a 20-year-old trying to impress someone on Instagram. Walking, yes, walking, just 20 minutes a day has been shown to reduce BPH risk by up to 30%. And if you're more consistent, say 6 times a week, your risk drops by up to 50%. That's half the risk just by putting on your sneakers and strolling around the block. Nature's medicine doesn't come in a bottle. It comes in the form of moving feet. 3. Rethink your plate. Let's talk food. Your prostate is paying close attention to what's on your plate, even if you're not. Here's what the research says. Eating red meat daily increases your risk by 30%, especially the fatty cuts. 4 servings of vegetables a day, that can lower your risk by 30%. And adding lycopene-rich foods like cooked tomatoes and watermelon might be a secret weapon. Lycopene is a powerful antioxidant that seems to have a protective effect on the prostate. My advice? Color your plate like a garden. Less steak, more spinach. 4. Watch out for medications. Now this one surprises most folks. Over-the-counter meds. Yes, even those innocent-looking allergy pills can make BPH symptoms worse. The biggest offenders? Antihistamines. They relax the bladder muscles too much. Decongestants, like pseudoephedrine. They tighten up smooth muscle. And some tricyclic antidepressants, which can mess with bladder signaling. If you're on any of these and notice worsening symptoms, don't stop cold turkey, but do talk to your doctor about safer alternatives. 5. Manage chronic conditions. Think of your body as one interconnected system. If you've got diabetes, high blood pressure, or high cholesterol, it's not just your heart or kidneys at risk, your prostate is too. Why? Because all of these conditions lead to, you guessed it, inflammation. Keep your A1C, blood pressure, and lipid levels in check, and you're not just protecting your life, you're also protecting your sleep, your comfort, and yes, your bathroom routine. Bottom line, you don't need a complete lifestyle overhaul to take control of your prostate health. You just need small, steady shifts in the right direction. And the sooner you start, the more power you hold. Now, if you're thinking, okay, doc, I've done all this, but I still get up 3 times a night to pee. First of all, bless you for trying. Second of all, you're not out of options. Next up, we're going to explore supplements. Which ones actually help, which ones don't, and how not to get ripped off at the vitamin aisle. Ready to go there?
Supplements for BPH. Hope or hype? Let's talk supplements, because if you've ever searched prostate health online, chances are you've been bombarded with ads promising miracle cures in a bottle. Saw palmetto, pumpkin seed, nettle root, you name it, they all promise relief. But which ones are real contenders and which ones are just expensive placebos? Let me break it down for you, just like I would for a patient sitting across from me. Number 1, saw palmetto, the prostate poster child. This one has been around forever. Early studies looked promising. Men reported better urine flow, less urgency, and improved sleep.
But when researchers ran larger, better designed trials, the results weren't so flattering. One big study with over 3,000 men, no difference between saw palmetto and a sugar pill, even at high doses. Now, does that mean it never works? Not necessarily. Some of my patients swear by it. And if a placebo helps you sleep better and pee easier, I'm not here to steal your peace. But from a scientific point of view, saw palmetto doesn't earn a gold star. Still want to try it? Fair enough. But be very picky about the brand. One study tested 27 different products. Only 7 contained the amount of active ingredient promised on the label. The rest, well, let's just say you might as well be drinking lawn clippings. Number 2, beta-cytosterol. A maybe, not a miracle. Next up is beta-cytosterol. It's a plant-based substance found in foods like avocado, nuts, and seeds. Some studies show it may slightly improve urinary flow, but the data is sparse, and we're still waiting on long-term results. Would I recommend it to my patients? Only if they've tried other approaches first. It's not harmful, but it's not magic either. Number 3, Pygium africanum, the African bark with a mixed resume. This one's made from the bark of the African plum tree. It does have a solid Cochrane review behind it, a fancy way of saying smart scientists looked at all the studies together. Verdict: it might help improve symptoms, short term. But the quality of the research was all over the place, and none of the studies followed patients long enough for me to feel confident handing out prescriptions. In my practice, I keep it in the maybe column. Number 4, pumpkin seed extract. Gentle, natural, inconsistent. Now this one's interesting, especially for folks who love natural remedies. Some studies show that pumpkin seed extract may lower symptom scores. Others show no change. My take? If you enjoy pumpkin seeds, by all means keep them in your diet. Just don't expect them to replace actual treatment. And please don't spend $50 on a super extracted prostate support blend unless your wallet really needs a cleanse. Number 6, stinging nettle. Only works in duets. Here's the thing about stinging nettle. By itself, it hasn't been studied much. But in combination with saw palmetto, some long-term studies, up to 96 weeks, showed mild improvement in urinary symptoms. Would I recommend it solo? No. But if you're trying a combo supplement that's been standardized and quality tested, and it includes stinging nettle with saw palmetto, you might see some benefit over time. Number 7, lycopene. Eat it, don't pop it. You've probably heard that tomatoes are good for the prostate. That's because they're packed with lycopene, a powerful antioxidant that may help slow down prostate growth. Here's the key though. Lycopene in food seems helpful. Lycopene in supplement form, not so much. So instead of popping a capsule, toss some cooked tomatoes or watermelon onto your plate. Your body absorbs lycopene much better that way. Final thoughts on supplements. Let me tell you something I tell all my patients. Natural doesn't always mean safe, and expensive doesn't always mean effective. There's very little regulation around supplements in the US. That means what's on the label may not be in the bottle. And if you're taking multiple supplements, you could be doubling or tripling up on ingredients without even knowing it. Also, natural doesn't equal harmless. Botox is natural too, found in soil. You inject the wrong amount, you're not relaxing wrinkles, you're relaxing your heartbeat. So before you start any supplement, talk to your doctor. Better yet, start with lifestyle changes, which we'll dive into next. Because honestly, a good night's sleep and an empty bladder don't come from a bottle, they come from habitual change. Behavioral changes that actually help. Small habits, big relief. Before we talk pills or procedures, I always ask my patients, what are you doing daily that might be irritating your bladder or helping it? Because truth is, many men see big improvements in their BPH symptoms just by tweaking a few daily habits. No prescriptions, no surgeries, just smart, practical changes. Let's go through the ones I see making the biggest difference. over and over again. 1. Let's talk about water. Too much, too little, or just right? You'd think drinking less water would reduce your trips to the bathroom, right? Not exactly. If you drink too little, your urine becomes dark and concentrated, and that irritates your bladder lining. Result, you feel like you need to pee more often, not less. But if you're guzzling water like you're prepping for a desert hike, especially late in the day, you're setting yourself up for nighttime wake-ups. Dr. Prescott's rule of thumb: your urine should look like light lemonade, not apple juice, too concentrated, not water, you're overdoing it. Cut off heavy fluids 2 hours before bedtime. You'll thank me at 3 a.m. 2. Caffeine, the silent sabotager. I know you love your coffee, me too, but too much caffeine is like throwing fuel on your bladder fire. It's a diuretic, makes you pee more, and it also irritates the bladder lining. The surprise? Caffeine isn't just in coffee and tea. It hides in chocolate, ice cream, yes, really, energy drinks, sparkling waters like Celsius or those Boost waters. Try cutting back for just 2 to 3 days and watch what happens. I've had patients go from 4 nighttime trips to 1 just by adjusting their coffee intake. 3. Alcohol, relaxing for you, agitating for your bladder. Alcohol's another diuretic, and it doesn't stop there. It relaxes the bladder muscle too much, increases urine production, and can trigger inflammation. If you're having a glass of wine with dinner and waking up more than once a night, it might be time to reevaluate. Try a test. Skip alcohol for 5 nights. See if your symptoms improve. Often they do. 4. Bladder irritants in disguise. Here's a quick list of common food and drink irritants. Citrus fruits and juices, like orange juice or grapefruit. Tomato-based products, yes, even pasta sauce. Spicy foods. Artificial sweeteners, especially in diet sodas. Carbonated drinks, including healthy ones. Again, I'm not saying you need to give them up forever. Just cut them for 2 to 3 days and see how your bladder behaves. That's your real answer, not some blog post. 5. Fluid timing. Control the clock. If your symptoms are worse at night, focus on what and when you drink after dinner. Avoid big glasses of water 2 hours before bed. Go easy on soup-heavy meals at night. Pee right before bedtime, even if you don't feel the urge. If your symptoms are worse during the day, then look at what you're drinking between 7 a.m. and 3 p.m. You might be front-loading fluids without realizing it. 6. Constipation, the hidden bladder bully. Here's something most guys miss. A full rectum from constipation can literally press against your bladder, making urgency and frequency worse. Think of it like a traffic jam behind your bladder. It can't expand properly. Tips: eat more fiber, fruits, veggies, oats. Prunes are a simple natural fix. Or talk to your doctor about Miralax or magnesium as needed. Clear out the traffic jam and your bladder often calms right down. 7. Smoking. Your bladder hates it. If you're still smoking, please, for your prostate, your bladder, your lungs, your sleep, just stop. The chemicals in cigarettes are bladder irritants, and they're linked to higher urinary symptoms, higher inflammation, and even higher bladder cancer risk. You quit, you win. In summary, your bladder's wish list. If your prostate could send you a memo, it'd probably say, hydrate just enough, not too much. Cool it with the caffeine, man. Ease up on the wine and tomato sauce. Let me sleep, stop drinking late. Clear the pipes behind me, I'm tired of being pushed around. And for heaven's sake, quit smoking. These are magic bullets, but they work better than most people expect. And for some, They make all the difference. Up next, let's talk about the medications. What works, what doesn't, and what you need to know before you say yes to that prescription.
Medical treatments for BPH. What works, what's worth it, and what to watch out for.
Okay, so let's say you've already tried the lifestyle stuff. You're watching your fluid intake, you've cut back the caffeine, you've even given up your nightly red wine. Well done, by the way. But you're still getting up 3 times a night, your stream is still weak, and you're starting to wonder if your bladder's plotting against you. That's when medication enters the picture. There are 3 main classes of medications we use for BPH, and each comes with its own benefits and trade-offs. Let's walk through them. No sugarcoating, just clarity. 1. Alpha blockers. Quick fix for flow. Names you've probably heard: tamsulosin, Flomax, alfuzosin, uroxetral, terazosin, doxazosin. These work by relaxing the smooth muscle around your bladder, neck, and prostate. When things relax, urine flows better, kind of like opening a kinked hose. Pros: fast acting. Many men feel relief within days to a few weeks. Great for reducing urgency and weak stream. Cons: retrograde ejaculation. Yep, it goes backwards into the bladder, not out. Very common with tamsulosin. Can cause dizziness, especially when standing up quickly. If you're having eye surgery, it can lead to something called floppy iris syndrome. Always tell your eye doctor if you're on these meds. My go-to tip: if sexual function is a concern, alfuzosin has a lower risk of ejaculatory issues. Worth asking about. 2. 5-alpha reductase inhibitors, the shrinkers. Names to know: finasteride, Proscar, dutasteride, Avodot. These don't just manage symptoms, they actually shrink the prostate over time by blocking the conversion of testosterone into DHT, the hormone that stimulates growth. Pros: great for men with larger prostates. Can slow progression and reduce need for surgery. Cons: it takes 3 to 6 months to see effects. Can cause low libido, erectile dysfunction, and sometimes depression in a small percentage of men. Lowers PSA by about 50%, which can mask prostate cancer unless your doctor adjusts the reading accordingly. What I tell my patients: this is a long game medication. You need to stick with it and have honest conversations about side effects. And always double your PSA number in your mind if you're on it. That helps us screen for cancer more accurately. 3. PDE5 inhibitors, the surprise MVP. You know these by name: tadalafil, Cialis. Yep, the same pill prescribed for erectile dysfunction is now FDA approved to treat BPH too. How? It relaxes the smooth muscle in the prostate and bladder just like an alpha blocker, with the added bonus of helping in the bedroom. Pros: 1 pill, 2 birds. Improves both urination and directions. Minimal side effects at low daily doses, 2.5 to 5 milligrams. Cons: some men experience sinus congestion, muscle aches, or indigestion. Not ideal for men taking nitrates or certain blood pressure meds. Who it's great for? Guys with both BPH and ED. You're getting a dual benefit. 4. Combo therapy, when one isn't enough. Sometimes we mix and match. Most often, tamsulosin plus finasteride or alfuzosin plus dutasteride. Why? The alpha blocker gives you quick relief, and the 5-alpha reductase inhibitor shrinks the prostate over time. Studies show that combo therapy is especially effective for men with larger prostates and severe symptoms. It also reduces the risk of surgery long term. But with double therapy comes double monitoring, so regular follow-ups are essential. So doc, what should I do? Here's what I tell every man who walks into my clinic. Start simple, build up, monitor closely, and always stay in control of your care. That means try lifestyle and behavioral changes first. If meds are needed, start with an alpha blocker and see how you respond. If your prostate is large or symptoms return, consider adding a shrinker. If you've got ED too, tadalafil might be your best friend. But never, ever, ever feel pressured into a medication you don't understand. Ask questions, push back, get a second opinion if you need to. Your body, your rules. Next up, surgery and advanced procedures for when medication isn't enough or you're ready to ditch the pills. But before we go there, let's close with a big picture summary, action steps, and a reminder that you're not alone in this.
The takeaway: you deserve relief, rest, and control. So here we are. You've just walked with me through the full map of BPH, from what it is, to why it happens, to how to tame it. And if you're sitting there thinking, well, no one ever explained it to me like that before, then I'll say this: welcome to the kind of medicine you've always deserved. Now let's step back for a moment and pull the whole picture together. If you're just starting out, begin with the simple things. Cut fluids 2 hours before bed. Ease off caffeine and alcohol. Pay attention to what irritates your bladder. Move your body 20 minutes a day. Tackle constipation head on. And stay on top of your weight and chronic conditions. You'd be amazed at how much control you can take back without a single pill. And if you're already struggling, don't be discouraged. Relief is possible even if you've been dealing with symptoms for years. Talk to your doctor about alpha blockers for quick relief, 5-ARIs if your prostate is large, tadalafil if you want to improve both urinary and sexual function, combo therapy if one medication isn't enough. And remember, you're not a statistic, you're a person. You deserve a plan that's tailored to you, not just what's in the textbook. And if you're thinking about surgery, that's a conversation worth having, but only when you've tried meds and they're not cutting it, or you're tired of side effects, or you just want a long-term solution. And good news, modern procedures are safer, faster, and more effective than ever. I'll be covering all of them in a dedicated deep dive next time, so stay tuned. My final word, as your doctor and your advocate: you don't have to suffer in silence. Waking up 3 times a night, feeling embarrassed by urgency, planning your day around bathroom access, that's not living, that's enduring. But here's the truth: BPH is common, yes, but it's also treatable. You can get your rest back. You can get your energy back. You can get you back. So if this episode helped you understand your body a little better, share it. Talk to a friend. Send it to someone who's been quietly suffering. Because the more we talk about this, the more we normalize getting help. And the sooner more men can start healing. And as always, take care of yourself. Because you matter. Because you're worth it. Disclaimer: before we wrap up, let me make this crystal clear. Everything I've shared with you today is educational information based on medical research and clinical experience. But your body is unique. Your symptoms, your risks, your goals, they're yours alone. Please don't take this video as medical advice tailored to you. Always consult your own physician or urologist before starting or stopping any medication, supplement, or lifestyle change, especially if you have other conditions or concerns. I know it's tempting to self-diagnose in the age of the internet, but true healing starts with a real conversation one-on-one with a healthcare professional who knows you. Take this video as a guide, not a prescription. And if it helps spark that next conversation with your doctor, then I've done my job. If you found this helpful,
do me a favor. Hit that subscribe button so you don't miss the next episode on surgical options. Leave a comment or question below. I read them all. And most importantly, start the conversation with your doctor. That first step might just change everything.